Welcome. We are about to get started. It's nice to see you, Dr. James. You're looking good in
Nice
your
to see
scrubs
you as
over
well,
there.
Dr. Dave.
Looking good in your scrubs.
Thanks, man. That's part of the reason why I became an anesthesiologist is so I could wear scrubs to work.
That's a good
Pajamas, really.
That's a good perk.
Keep it comfy.
Yeah. All right. Well, why don't we kick things off and then more people will arrive as we get going. So welcome everyone to another Apollo Neuroscience webinar. I'm your host, Dr. Dave Rabin. I am a board certified psychiatrist and neuroscientist, as well as the chief medical officer and co-founder and co-inventor of the Apollo technology, which you can see that I'm wearing on my chest right here, and Dr. James wearing on his chest. And so the Apollo technology is a tool that we as physicians use to help improve the experience that our patients have and our clients have with receiving care. And there's lots of reasons why tools like Apollo are very helpful to that. And one of the folks that is here to talk to us about that, because he's been using Apollo in his clinic, which is the Advanced Wellness and Pain Ketamine practice, and delivery, and has been using Apollo to assist in the delivery of treatment to patients for a number of different things, which is very exciting, and has seen great results. And those results echo the results that we see in our clinic, treating patients with ketamine therapy as well, which is very interesting. And so we want to, as it's so helpful to have more tools in our toolbox as clinicians to be able to deliver better care to our clients that is not just in the office, but also helps reinforce what we're trying to do in the office at home. I'm here to talk with Dr. James Leatham, and Dr. James is an anesthesiologist and I think co-founder of Advanced Wellness and Pain, and an expert physician in treating a number of different conditions, from depression to PTSD and to pain disorders, using intravenous therapies, which are becoming very popular. And there's not a lot of people who are truly expert in them. And so I'm really grateful to have you here, Dr. James, to share with us about your experience and what you do at Advanced Wellness and Pain that is so unique.
Thanks for having me, Dr. Dave. Really appreciate this opportunity. And yeah, I'm Dr. James Latham, board certified anesthesiologist, and one of the co-founders of Advanced Wellness and Pain. We have two clinics. We have one in Scottsdale, Arizona, and then one in Gilbert, Arizona, that was opened up a few months ago, actually. In our Scottsdale location, we have 5 private treatment rooms. In our Gilbert location, we have 6 private treatment rooms. And we use ketamine as a powerful tool for transformation, for a mental health standpoint, as well as a physical pain disorder standpoint. But that is just that, it's a tool. And we wrap it around a complete program. And we can, get into that and kind of talk about, how we use ketamine as that powerful tool, but not the only tool in the whole process. It's a powerful medicine. It's only FDA approved as an anesthetic, in 1970 that happened. Then over time, people started to realize the rapid antidepressant qualities of it. And then in 2020, we formed Advanced Wellness and Pain as our COVID pivot. I was working in the hospital as an anesthesiologist. I wouldn't have switched gears had it not been for COVID. I'm glad in a way it happened, because it got me into finding my ikigai, which is finding what you love, what you're good at, the world needs it, and you can make a living from it. So this is my true passion, for ketamine, for psychedelic medicine, to help people to activate that inner healing intelligence that I know Dr. Dave knows a lot about, and give them an opportunity, that window to heal. Ultimately, we are usually, when it comes to mental health, the cause and both the cure, if we can tap into that subconscious mind. And ketamine rapidly allows us to do that, as long as, number one, we're in a safe, optimized set and setting. Unless you're safe, you can't even start to heal. And the Apollo is that device that helps create that safety net, and is our first touch point when patients come into the clinic. So I want to hit all 5 senses, and Apollo is how I activate touch from the very start.
Oh, that's really interesting. And from the very start, it sounds like when people walk into the waiting room, this is like one of their first experiences with your clinic is to receive the Apollo.
That's correct. Right when they come in, we're brand new to them, although we had talked over the phone, maybe done an in-person consultation if it was warranted. Of course, a full medical history, screening, making sure all these things are safe and appropriate, doing survey scores, which we can get into that as well. Because if you don't measure something, you can't manage it. But that's our first touch point. Rose or Danny, our receptionists, shout out to Rose and Danny if they watch this. They'll put the Apollo on as that first touch point. It's that wearable hug. It's the purring kitten on your wrist. I know you got wearablehugs.com, and it's perfect. That's what it is, right? To create that feeling of safety, because it's a little invasive for me to first meet you and give you that hug, even though I'd like to. But if I could put this on your wrists, and we usually have on calm or recover, and all of a sudden it's like, wow, all of a sudden my nervous system isn't so much in fight or flight, and I have this calm feeling come over me. And then now what's next? Now I'm feeling more safe. Now I'm open to this whole healing process. So like I said, I try to hit all five senses. So it touches the Apollo, and then sight. We have lots of visionary art all around the clinic, from Alex Gray to Amanda Sage, Allison Gray, Simon Haydock, Randall Roberts, Blake Foster. The list goes on and on. Like, just huge fan of visionary art. And then also we have you pick out an essential oil so I can engage with the sense of smell. And then sound, we're going to pick out all the music for you, as well as right when you come into the clinic, there's already music playing that's very tranquil and relaxing and ethereal with usually no words to it. And then taste, how am I going to hit taste when I'm giving someone ketamine? Well, I'm going to give you a little secret. Element popsicles. So I take Element, which is like liquid IV, but minus the sugar, because one patient's like, I don't want the sugar. And so then I switched to Element. Element T, usually hear about them on Rogan or Huberman or any of these places as a sponsor. Turn that into popsicles, and that's as they're leaving the clinic, I'm helping their electrolytes, the magnesium, the potassium, the sodium, because they've been NPO for a few hours. They're a little bit probably underhydrated, especially here in the desert. And I want that to be the first thing taste-wise that starts to bring them back to life after they've had this potentially transformational experience. So hit all the five senses, more likely to create a neurologic imprint, more neural connections happening, more likely to be a transformative remembered experience, so that we can get more longevity and duration out of these treatments. Ultimately, like, nothing lasts forever, everything takes maintenance, but I want to solidify this as a key experience for them by hitting all five senses.
Yeah, I really like the way you describe it. That's such an interesting and truly unique approach. And I think that what it really conveys is this understanding of the immersive environment, and having multiple things kind of in harmony with each other, like multiple senses that are in harmony. So they're, rather than things seeming different and almost like, how do I understand how this construction sound is supposed to match with my like healing experience, right? It's more of, how do I create this really nice environment that's harmonious or resonant with the state that I'm trying to get people in, so that everyone's kind of settled down a little bit before they walk into an experience that might be somewhat unfamiliar to them. And that unfamiliarity can kind of like, make people, it sounds like it makes people a little bit afraid. And so what you're doing is you're helping curate the environment to help people feel safe enough to drop into the experience. Is that fair?
100%. You got to be safe, number one, and then you can start to heal. And just to resonate what you just said there, which is perfect, you said you want things to be in harmony. Well, we use vibroacoustic therapy from the company In Harmony. And that's another one of the technologies that we layer on, so that, how do you land after a ketamine infusion? Do you just sit there in the chair and wait? I don't think that's really that good. I'm going to give you a little bit of time to kind of get your bearings back. Then we're going to go on a meditation cushion. By In Harmony, I'm going to help to bring you out of the ketamine funk. I'm going to help to get you into different brainwave patterns with certain healing frequencies. So it's like taking the Apollo as that first sound vibrational technology, and then layering on vibroacoustics after that, and then working up towards an experience on the vibroacoustic bed by In Harmony, which we call the Ketamine Masterclass. And that's, it's all about layering technologies onto this, and not just treating the medicine ketamine as the entire tool. And then integration is a part of it as well. Like, there's so many layers to it, and it's beautiful. It's optimizing set and setting. It's a dance, and this is not how we started doing things day one. It's always being open to continuously evolving your process, not being stuck in a paradigm. And as we learned about Apollo at Meet Delic, my two partners, Dr. Sharma, Dr. Wan, they first met Dr. Dave. And I was actually on a wild hunt to try to find a jacket I had lost. But anyways, they met you, and then they were like, wow, this technology, we got to bring it in the clinic. They were really excited about it. And then we did. And it's going to these conferences that gives opportunity a chance to happen, just like psychedelic science we just came back from. It's like we just went to the hive and now we got the honey, and now we're going to go back out and pollinate the rest of society and bring them back to the hive as well, because these are tools for healing. It's not band-aids. It's getting you to activate that inner healing intelligence, in a safe setting that's optimized.
Yeah, I think that's really interesting, right? It's almost like we're trying to help people feel safe enough to allow their own the part of themselves that knows how to heal themselves to activate,
100%.
right? And almost like if you were to imagine that healing is like a seed that you're going to plant in yourself. You want to have like a fertile, really nice soil that's nourished and ready for that seed to plant and actually grow and blossom into something meaningful that lasts. And so it's the combination of all of these approaches, the multisensory approach, that helps people to feel safe enough to be able to allow that healing experience to unfold and that healing plant to grow. And I think it's really interesting because you're describing this as an anesthesiologist, and a lot of anesthesiologists, and many of whom may be listening to this, often are taught that, especially by many of the boards that talk about ketamine delivered intravenously predominantly or intramuscularly, it's talked about that the psychedelic effects of ketamine are almost described as like an unintended side effect of the experience, and that the deep interpersonal reflections and these different senses of like joy and observer mind and these kind of altered mind states are not actually part of the healing experience, which I think is a very interesting way to think about it, because that's not, as a psychiatrist, I would, when somebody who's doing a lot of therapy, it's for me, it's like the primary thing that I focus on that actually gets people to the end point, that is their goal of remission from their symptoms, right? Ultimately, we want people to no longer be symptomatic so that they can feel better and heal and start to, take control of the healing process on their own. And it sounds like you as an anesthesiologist have come to that conclusion on your own, which is very interesting. Can you tell us a little bit about that?
Yeah, so true. We approach ketamine as a psychedelic medicine, and that's important always to define that word, because we just throw it around, and like the word integration as well. But psychedelic, psyche, mind or spirit, delic from the Greek word delos, to reveal meaning, to manifest, to show. And then where did this word psychedelic actually come from? Humphrey Osmond in the 1950s, in a conversation with Aldous Huxley, said to fathom hell or soar angelic, just take a pinch of psychedelic. And that summarizes actually perfectly that you can fathom the depths of hell, that you can feel the feelings of soaring angelic, all with this one substance. So we don't shy away from that side effect. We actually think it's the real healing effect, is to get into your subconscious mind. It's very mind revealing. Allow these subconscious thoughts to percolate to the surface and use that as the fuel that we're using to reflect upon and heal. I feel like we're stirring the pot. Your mind is like a pot of stew. And over time, we're just pushing down our feelings, depressing, pushing down the feelings. Ketamine brings the feelings to the surface so we can skim off the substance and heal, remove the brick from the backpack, right? And change our emotional attachment to past memories or traumas with more of a neutral attachment. So approaching as a psychedelic is essentially exactly how we approach it in our clinic. I definitely never don't shy away from that word. But then in anesthesia, we always like ketamine, emergence delirium. And you hear that, so people are scared of it. Well, let's look at the context in which the ketamine is being used in the hospital. You just had a surgery, right? And you're waking up, you're probably cold, you're in pain. You might not know they're going to come out from ketamine as part of the balanced anesthetic. And yes, you can have an emergence delirium. But when we're doing it here in the clinic and it's sub-anesthetic dosing, and we're going from like a psycholytic phase to a more psychedelic, to a more dissociative, to a possible out-of-body experience in a controlled setting, that's how we're seeing profound healing and transformation. So our approach to ketamine is as a transformational medicine, as a transformational approach. Rather, here we're going to give you this medicine, we're going to hit the NMDA receptors, we're going to kind of reset things a little bit, and you're going to feel better, and we're going to see you next time. Like that's more the medical model. We want the transformational model. But that's what's beautiful about ketamine too. And medicine is an art and a science. So no one way is the best way. It's just that we have arrived at a way that we think is most optimal. And we're really evidence-based in our clinic. We use Osmind as our EMR. And so we can look at our analytics and see like some of the percentages and, say like after you finish your 6th infusion, when are you having your first booster? In our clinic, as of today, 73 days is when you go from your last booster or your last 6th infusion to your first booster. The national average is every 3 to 4 weeks. Why is that? Because we have more of an integrated program. So we also have integration coaching partners and a workbook. It's an entire program in a safe set and setting. This is like an art sanctuary turned into a psychedelic medicine healing center. And that's why I think we're getting longer term results. The magic equation is ketamine plus daily integration practice equals conscious transformation. It's not ketamine equals transformation. And then as an anesthesiologist, we do layer on other medicines with the ketamine, like NAD plus, magnesium, Pitocin,
Yeah, well, before you get into all that, because that's a whole
other word, bucket,
yeah. But we can get into that. I think we should save that for another
totally, just a little taste.
Yeah, because there are a lot of things that you can add in the IV setting that are very interesting that can help improve the experience. But I think you said a lot that was really interesting and important that I want to come back to, which is this idea of how you kind of eloquently described how you think about ketamine as a psychedelic that is facilitating a conscious transformation. Right. And I think while that is super exciting for the healer, for the person who's sitting in our position, I think for the client on the other side, what we often forget is that, or the patient, that they see the word like transformation and they're like, am I losing part of myself in this process? Right? Like, is there a part of me that I need to hang on to because I could lose that part and along the way as part of this transformation? And I think that creates a lot of that, amongst other things, and the newness of the experience can create some anxiety for people, right, going in. And we know that anxiety is one of the biggest reasons why our clients and our patients have unpleasant experiences or don't really have, deep experiences with the medicine. And so it sounds like Apollo is an important part of your preparation in helping people get from the door to their entry into their experience. And I was wondering if you could talk a little bit about, you talked about how you use it, but what impact do you think it has, and how do you think it helps people prepare to drop into the conscious transformation that is ketamine, knowing that they're not going to lose themselves, they're only going to find more of themselves?
Yeah, well, I always approach the first infusion as ketamine 101. So we're just getting to know the medicine. And the beauty of IV is I call it the most controllable psychedelic medicine experience on planet Earth, because I can hit the stop button and help you come out of that, and then use different grounding tools. And that's why Apollo is a grounding tool, right? So that you can connect back to body if things are starting to kind of get a little wow, maybe I'm dissociating right now. Okay, but I can feel that vibration on my wrist. So I know I'm still here right now. I have my crystal in my hand. I can put my thumb on the tip and feel that sharpness. I'm still here, right? Oh, I can smell the essential oil. Oh, yep, I'm still here. Sense of smell still works. I'm not actually dying. I'm okay. So you're not going to lose a part of yourself and transform, but we are shedding layers of the ego that no longer serve us. So Apollo is a powerful grounding tool. And it's a way to knowing that, for 30 minutes, we have a go during the first 30 minutes of the infusion. And then they have the option, hey, just click the 2 buttons. You can turn it right back on if you need that tool. So I'm just kind of trying to set the stage with the Apollo, and then they kind of go away from it. But then when I go in and do a 30-minute check on them, I can turn it back on if they want me to. So that's something that's different as well, is that we do a 30-minute check and we'll do a bolus or push dose then as well. I don't want to get you just in the ballpark. I'm trying to get you in the front row seat. Apollo is just a part of the whole process, but also it's something that they can take home, right? So that now we're exposing everyone to this technology. We talk about care before, during, and after. Apollo is a part of the before, it's a part of the during, and then it's a part of the after. So that now you have this device, and it's clinically proven, double-blinded placebo-controlled trials, thanks to Dr. Dave, that if you wear this device 3 hours or more per day, you're going to have less anxiety. Your sleep's going to be better. Your heart rate variability is going to increase. And it's no drugs. There's no side effects. What is there in medicine that has no side effects, that helps anxiety, and helps sleep? I don't know of many things. Apollo is one of them. So if you're running a ketamine clinic and you're not layering on Apollo in your process, you're doing a disservice to your patients. I think it needs to be a part of it for every psychedelic, whether it's MDMA trials, psilocybin, have this grounding tool that's right there. And I like it on the clip, because it's close to my heart. It's closer to the vagus nerve, but you can also do on the wrist or the ankle. So it's very versatile. And I loved learning about how I was like, how do you double blind people to vibration? And then you answered it. And it was like, oh, we just give erroneous vibrations. And the person administering the vibe didn't know. So it's like, oh, this is brilliant, right? Like this device, it's, it's simple yet sophisticated. And I've used this thing hundreds and hundreds of hours, and it has not failed me. It's very robust. So I think every clinic, every patient going through any psychedelic experience should have the Apollo as one of their tools. We've even thought about maybe just including it as part of our package initially, increase the cost of the program, and just automatic, you get an Apollo as part of the experience.
It sounds like I'm so glad to hear that you're having such a good experience with it, right? That's like, it completely makes my day. I'm almost blushing, but I think I think it's like really what we aim for as clinicians, right? Like we spend our entire careers devoted to trying to improve the quality of care we can give people. And so to hear that this is helping so much is really heartwarming. And, I think we talked about preparation quite a bit and trying to help people, do grounding exercises to feel calmer, to be more ready to drop in and let go, to enter into the experience. Seeing almost like the way we describe it in our clinic is like ketamine, the medicine experience itself is like a teacher, and entering into the experience, kind of ready and willing to learn whatever the medicine has to offer us during that experience is what really gets us the most out of it.
Correct.
And that requires us to feel safe, as you were mentioning earlier. And Apollo is a really helpful safety tool that we found as well in our clinic to especially help people who have never learned to deep breathe or never learned any kind of meditation or mindfulness exercises to feel what it feels like to be in that state, as you're saying, which is like a very grounded, present state. And then that helps them drop in, and then it helps them feel, restore agency and feel more grounded during. And then afterwards is this period called integration therapy that many people don't actually do. And it's probably the most neglected part of the treatment process. You alluded to the fact that you felt Apollo was really helpful for your patients in that integration phase. I think the reason why, I don't know if this is the same for you, but for my patients, I think the thing that I hear the most about Apollo after in the integration phase, and integration means effectively the therapy that we do, the talk therapy, and the therapeutic work that we do, what the client does after the medicine experience, that helps to unpack what they learned during the experience, and then fold that into their lives, or kind of like knit that into the fabric of our lives moving forward, so that it actually becomes part of what we're learning from ourselves, and not just something that we had a nice experience one time and then we forgot. So the integration is really critical to the long-lasting benefit that people can get from the use of these medicines, especially as you describe them, the psychedelic medicines, and the way that ketamine is used as a psychedelic medicine. This can amplify the effects is doing these practices. And it can be something as simple as like practicing gratitude for yourself instead of thinking about how you're unworthy of love and you don't deserve, you're not good at anything, right? So all of those things, like it's just could be something like simple, like changing your thought practice. And so I was wondering could you talk a little bit about the way that you do integration and how you feel it helps, and can you talk a little bit about how you feel Apollo helps in that integration phase specifically to kind of like, anchor patients on their journey?
Yeah, I mean, with Apollo, if it's something that was there before, during, and after, and then it's part of the memory, it's part of the experience. And if they can take that home with them and say, wow, I have this safety blanket, this thing that meant a lot to me in the infusion. And, it's not required, we just suggest they purchase it. And I really am thinking about maybe every patient just getting it as part of the program. But as far as the integration work, I'm grateful to have a partnership with Being True to You. They're an integration coaching partner of ours, and they have a company, and I went through their entire 5-month program. Like it was 30 lectures, also taught by Dan Adamson and Dr. Dan Engel. Incredible program. I actually think going through Being True to You was being true to me. And it really kind of got me to learn about this word integration, because I didn't understand it for a long time. And it just means to really make something whole, right? And the best way to understand integration is the opposite, disintegration. So we know if something disintegrates, it's, billions of pieces. So integration is to make it whole. So they are a part of our process, and we co-authored a workbook with them so that the patient, before they even come in, They've done a 1 hour preparation session over Zoom with a Being True to You coach. They have the same coach every time. And then we match them. They have like over 300 coaches in the network. It's an incredible community. It's not just a coaching company, but really it's a Being True to You community. And then you've done that 1 hour prep, you have the workbooks, you're doing that work because proper preparation prevents poor performance. And then you come in and you have your first infusion with us. And then us as the doctors are always going to do the first infusion. We're going to teach you meditation, breath work, mindfulness, metacognition, thinking about what you're thinking, being the radically curious observer. All these things are vital aspects of navigating the infusion. And then the Apollo is going as we're going through all this stuff, right? It's all part of that. And then as they're starting to feel the infusion, I'm talking through breath work and meditation and mindfulness, then they go into the experience. Apollo's with them the whole way. And then they have that journey. I want them to go within. If you want to go within to get beyond what holds you back. So you have the mindfold on. External life is always here. For 1 hour, go within. See what's in there,
The eye mask is really important.
Crucial. Yeah, the mindfold, crucial. And Alex Gray invented the mindfold in 1978, and then he sold the patent. So mindfold.com, buy 100 of them. They're $7.50. If you buy 100 or more, like great, super cheap.
And just to emphasize why we're talking about the mindfold specifically, the reason why that's a particularly good eye mask is because it is a blackout eye mask or almost completely blackout eye mask. So you can open your eyes under the mask and still not see anything. And that creates a really strong effect of sort of like internal focus for the experience. That's very nice for our clients, and it helps to really amplify the experience when they can just kind of focus inward and not worry about whether or not their eyes are open or not, or whether there's light coming in or not. It's just darkness.
Yeah, and it has cutouts too, so it's not going to hit the eyelashes if someone has like extensions or something like that. So it's very specific. Very nice. It's patented,
Yeah.
That's incredible. And then we have the music goes on and we step out of the room, then they do their journey, come back, do that 30-minute check, come back at the end of the hour, turn off the pump and everything. And then, being true to, like, we do a little integration with them. Like I said, the vibroacoustics, the meditation cushion and harmony to help bring them out. They're in the clinic 2 hours, hour infusion, but you're in the clinic 2 hours. You can't rush this process. The landing is almost as important as the infusion. You can't land in a raw way. We just took the Band-Aid off the wound. The wound is exposed, therefore we can heal it. We can also contaminate it. And when you leave the clinic, the wound is now exposed. So what are we doing after? We're in this neuroplastic state. Are we engaging in adaptive neuroplasticity or maladaptive neuroplasticity, right? All things to be mindful of. And then being true to you as far as the integration component.
And that heightened neuroplasticity, we think with ketamine is like something like 72 hours in particular, is particularly high for 72 hours, correct?
Yeah, exactly. Yeah, so realizing that when like most of the gains happen outside of the clinic. We tell patients 95% of the gains happen outside of the infusion experience. Everyone wants that epiphany, that aha moment in the medicine, right? Usually it comes during the integration. In order to become great, we must integrate. And then basically being true to you, we'll then do a 30-minute integration call the day after infusions 1, 2, 4, and 6 for our protocol. And then you're able to have a sleep, get the memories to lay down in the hippocampus. And then the next day, you do the integration session so you can have a productive integration session. I know there's ketamine-assisted psychotherapy. That's great. I think better with like a psycholytic, Lodgins dose, intramuscular, lower dose. But with IV, I want you to go within, reflect, and then the next day integrate. Because it's like you just watched the movie. The wheel's still spinning on the download. Give it a day to process. The next day, they get so much more out of the integration. And then so our program, automatic, every patient required 3 hours of integration when you go through our 6 infusion program, with being true to you. So just so much, admiration for what Dean Adamson has created there. And they do a lot of that heavy lifting, for us with the integration. And I had to go do the course. Otherwise I wouldn't have known exactly what they're teaching them and helping them to navigate. And a great coach really just brings out the answers within you. Like a sports coach, right? Versus a therapist or counselor, because if they're going to submit to insurance, they need to get those diagnoses codes, right? So they need to like ask certain questions, and there's a little bit of an agenda there because I want to bill insurance, whereas this is all cash. So I'm just here to support you on the journey as the coach and find the answers within yourself. If you want to, like, integration, I think is best, especially with ketamine. I can do my integration poem if you'd like. Might be kind of a fun little soundbite. Do I have the time and space to do so?
I think so. Why not?
All right. So in order to become great, we must integrate. To integrate something is to make it whole. Do not fear the K-hole, Rather, think of it as the K-hole with a W. To evolve your paradigm of associations, look, the K-hole is actually dissociation. And dissociative experience, the out-of-body experience, is, I think, paramount and really required to get the max benefit out of ketamine in a safe setting that we worked up to with as our ketamine masterclass. Not day one. Day one is just getting to know the medicine, with Apollo there as the safety belt, you know?
Yeah, it's
About this, like, it's just, this is my life calling, honestly, and I get to be authentically me and help people on their healing journey. I'm just trying to empower every human being that I come in contact with. And ketamine, like I say, ketamine is the key to me, and it can be the key to a lot of people. It's just one of the keys, though. There's so many other keys: diet, exercise, sleep, relationships, screen time, meditation, breath work, cold plunging, like so many different keys. Tap into this internal pharmacy that we're all carrying around.
yeah.
Yeah, so many different things.
Well, I think that's what's I really appreciate your passion and your dedication to this work. And it's so interesting to think about the way you're describing the psychedelic experience and the way we describe the Apollo experience. And it's this idea of giving people the memory, or the reminding people of what it feels like to feel safe and to feel able to heal, right, and to be able to feel better, for lack of a better term, and helping, once you help people understand that experience, even, or whether it's coming from Apollo, or whether it's coming from ketamine or breathing or meditation or soothing music or any of these other things, right, that it, or all of them in combination, then you don't really know how to aim for that feeling on your own. Right. So there's certain things that we learn experientially, where if you know what it feels like to access a meditative state or a deep breathing state, before you've ever actually accessed it by breathing yourself there or meditating yourself there, then you know how to aim for that feeling, right? You know how to do things that will at least start to get you in that direction. And if you're going too far the other direction, you'll know.
Yeah, ketamine is a show you, not a tell you. I'm putting people in a state of ketitation. Right. This is a biohack. This is a cheat code on getting into the meditative mind.
Right.
We know that if you do 8 weeks of daily meditation, we get neuroplasticity and changes on functional MRI, right? On just meditation. Let's jumpstart that whole process and catalyze it. Ketamine is the catalyst with the meditation and all these other things we've talked about, so that we can really change the brain on a functional level and really get people unstuck. It's the most rapid antidepressant, anti-trauma medicine, anti-suicidal agent that we currently have in medicine. I just feel like so thankful that it's going to get thrown into Schedule 1. Ironically, 1970 is when the FDA approved ketamine. In 1970, it was a Controlled Substance Act. Well, they unknowingly gave us one psychedelic and took all the other ones away. Kind of interesting.
Yeah, I think yeah, it is. And I'm curious. I know I want to be extra respectful of your time, because I know that you have patients right now.
You got me right now, man. Dr. Sharma, thank you, is handling business right now.
Well, yeah, yes, thank you so much, Dr. Sharma, and we'll have him on next time.
Yes, please, and Dr. Wong too.
And Dr. Wong. But I wanted to ask you, since I have you, could you talk about, are there any particular, you've seen a lot of patients with ketamine therapy, and you've seen even more, and you've seen a lot of patients with ketamine therapy using Apollo, and you've seen a lot of patients with ketamine therapy in general, in your career. Are there any particular stories that have stood out of patient experiences that were really remarkable to you?
Oh man, so many. I'll just go to one because their mom actually reached out to me today. He's 16 years old. I'm not going to say his name, of course. The mom reached out to me today and was literally like, I just want to tell you like how much you meant to our family. You saved my son's life. He's 15 years old, suicidal, tried Zoloft, like tried other SSRIs, like didn't like how he felt on them. Just felt like the zombie, was not helping him. His mom is more of like, think outside the box, alternative medicine, like there's got to be something else. She found us, and as a minor, she had to consent for the treatment with us. I would love to be able to like show like his graphs of like his PHQ-9 and his PCL5 and GAD-7 and his suicidal ideations. Like it was way up high, about as high as you can go, and it's down to like zeros across the board. And he's had, and this is like 2 years of knowing him, so I was doing the 6 infusions, And then after, just coming back like once every few months, once a quarter. One time he's like, oh, there's a full moon. I just want to come in and tap in to the energy that's happening, in the universe around us, and tap into myself. And he's off all medicines, no suicidal ideation. She got her son back. What does that do for society? If you save a 16-year-old or teenager, and then they are able to cause a ripple effect or butterfly effect in the world around them and give them hope, that ketamine is instilling hope. It's not dope. Ketamine clinics Los Angeles, the whole thing was hope, and it's hopium, but it's not hype. And he was like one of the examples that sticks out. Countless firefighters. Well, we've had over 90 firefighters come through our clinic. We have a funded study with the 100 Club, thanks to Bob Parsons and GoDaddy. And ketamine, I think, works the best for PTSD, and then works depression, number 2, anxiety, number 3. We have in our clinic an 86% success rate in treating PTSD, and we define success by having a 50% or greater reduction in your PCL5 score, following people out basically for 3 months, and they get 6 infusions with 1 booster and 8 hours of integration coaching as part of that program. They're all getting the Apollo on them as well. So countless firefighters, like, changing their lives and their families' lives. Just teenagers that we've helped with suicidal ideations and depression. We've done over 4,000 infusions on several hundred patients. Collectively, between me, Dr. Wong, Dr. Sharma, over 40 years experience as board certified anesthesiologists. And, it's art and a science, and we don't do it the best way. We just do it the way we think is best currently for patients. I'm always cognizant of the paradigm that I'm in and always looking to evolve it. And that's why we go to things like psychedelic science to see, hey, how are you doing things? Go into ASKP, the ketamine conferences. There's one that's coming December. Hopefully you're there as well, just to get around like-minded people. Hey, how are you doing it? Because initially we didn't do integration. We knew it was a vital component, but I couldn't get people in with a therapist. And then even if I could, it was hard to coincide the dates and the times, and they might not have experience working with psychedelics. So really, it's the whole team, makes the dream happen. And I can't wait for other technologies in addition to the Apollo that we can layer on as well, because that's only just going to keep making it better. There's a thing called Sound Self that was at Psychedelic Science. That's with toning, and maybe we can layer that onto this practice as well.
Yes, singing is really helpful. I mean, that's one of the things I think is really interesting, right? Is that when you teach people how to breathe properly, and you start by doing all of these techniques that we're doing that soothe the body, I think are in large parts, they center around restoring our connection to our breath and our awareness of our breath, right? And then as soon as you start to notice that you're breathing in a way that is changing how you feel and it's working reliably, then you can start to tap into these other parts more. I
got to give you one little liner. The patient just dropped this on me today. Shallow breaths, shallow thoughts. I was like, boom, that's amazing. Deep breaths, deep thoughts. The mind follows the breath. The body follows the mind. Who's in charge? The breath. Who's in charge of the breath? You are. And also your autonomic nervous system when you're sleeping. So bring awareness to the breath. And the breath is always with us. As long as you have breath in your body, there's work to be done. And it's one of our most powerful tools. A lot of the things that we teach people that are the most transformational are free. The breath, journaling, exercise, sleep, diet is not free, but you get the idea. Like these things, like those are the core foundational principles. And then giving people other things to access outside of these infusions after. Get some good screen time. So Wisdom of Trauma with Gabor Mate is amazing. Netflix has a series called Headspace. So anyone has Headspace on Netflix, go check that out. There's a meditation series, a sleep series. Wear your Apollo as you're watching it, to further reinforce that. Stutz is an amazing movie on Netflix as well, teaching people different things to help with their mental health. There's just so many resources out there, so many keys. And Apollo is definitely one of those keys to help on this healing process for patients. So I honestly think right here talking with you, I'm going to talk to my partners. I think every patient should get an Apollo as part of the program. Why not?
We do that at our clinic. It makes such a difference. Because then, if we can reduce people's symptoms by 10, 20, 30% just by doing like natural techniques in Apollo, the first few weeks that we're working with them or the first month we're working with them, that could prevent them from having to start a medication.
Correct.
Right? That a medication they might be on for years to come. So for us, it's a huge win because then we can really start to get them from the beginning into the mode of, understanding that there are other paths that they can take in the healing experience, and that how they're thinking about it and what they're doing about it actually has an impact.
Yes, that'd be like a whole other discussion, is other medications that are more natural approaches that we add on to this whole experiential journey. I would just, like, just
That's
for the little
that's
tip later.
definitely the next one.
Yeah, CBD,
Yeah.
proper dose, like that's a game changer. Magnesium L-threonate, another
Mm.
game changer. Like there's so many things to layer onto this. Like ketamine is just part of it, but it's a vital part of it. But this is an experiential journey around the medicine with the proper support in a safe setting, hitting all five senses. The Apollo being our first touch point, and now maybe our last touch point when they walk out of the clinic. I like that we just brain shined on that. I'm going to talk to him. Let's add the Apollo on as this part of the program, a value add.
Yeah, I mean, what I'm thinking about as you're saying it, it's you described it earlier. It's this really interesting concept, which is like doing things that remind you of what it feels like to have been in the experience, help you get back there. And the whole point is to try to teach yourself how to get back there.
Yeah,
And like we know this because music, when people listen to music after they've heard a song during a really special experience, it reminds them of that special experience, right? And it creates that those positive emotions. And so we can do that with vibration too. And that's one of the things that we've noticed is what people like so much about the Apollo after they go through treatment is they take, or as they're in between in the integration phase after they experience the medicine, is they use it, as you said, to kind of remind them of what it felt like to be in the medicine experience and how to get, and then they're more likely to do things that get them back there.
correct. Yeah, people always ask me, hey, how long does the ketamine last for? The answer is it depends, but also has the potential to last the rest of your life if you continue to integrate the realizations that you had with the medicine. And then if Apollo was there as one of those things that was there with you on that journey, and you have that at any point in time, click, turn it on. And it's great how it just goes right back to the last setting that you had. So it's not like you have to pull out your phone and do anything with it. It's right there, boom. And you can go up or down with the vibration. And then having that sense of smell, right? Like having the song that meant something to you in the experience, because we'll give patients our music as well after if they want to go back and listen to it. The answer is psychedelics. These experiences have the potential to last a lifetime if you continue to integrate them into your daily practice. The daily practice is the key component. Ketamine gets you unstuck. It's the reset button. If your mental health is a house and it's on fire, ketamine will put the house fire out. It will not rebuild the house. You must do that through the daily practice. And action provides information, and the practice, the integration, it's like watering a plant. You can also overwater it, right? So being mindful, like your analogy of the seed, our thoughts are seeds. The mind is the soil, right? And whatever you plant in that mind soil, it's going to grow. This is from Earl Nightingale, The Strangest Secret, 1956.
Mm-hmm.
That the mind is everything. What you think, you will become. So think about what you're thinking, metacognition, and be mindful of the seeds you are planting, and then grow them, through proper integration and daily practice, and allow the Apollo to be a part of this entire integration, this entire psychedelic medicine experience. And you're more likely to have a successful outcome, increase the likelihood.
That is a great way to describe it. Really appreciate you taking the time, Dr.
Anytime,
James.
man. For
You
Dr.
so
Dave,
much.
anytime.
And please let everybody know where they can find you and your clinic and learn more about your work, because I think you'll probably get some people who will be reaching out, asking for tips about different things. And so let everybody know where they can find you before we wrap up.
Definitely on Instagram, psychedelic_DRS. You can call our clinic, 480-631-4800. And then our website is, we had a short one, it's real easy, Delic Doctors, so DELIC.DRS.com. Just like Wearable Hugs will take you to Apollo, Delic Doctors will take you to AdvancedWellnessandPain.com as well. And we do free phone consultations. We are here to help you on this healing journey. And when you come through our clinic, you're a part of the family, you're a part of the team. And we're trying to bring back to medicine what is missing, the doctor-patient relationship, right? Giving people the time to be heard and seen and to heal and not be rushed in a 15-minute consult, rushing out the door, Band-Aid approach. This is what I wish existed if I was going through a difficult time. That's what we created, and I live life like, what would your 70-year-old self tell you to do right now? Usually it's take the chances, right? I'd rather try and fail than never try and wonder. And that's part of the reason why this clinic exists.
Yeah.
So thank you. Check us out, reach out. Dr. James, I got psychedelic blood evolution on my veins. I'm here to help heal and raise the collective consciousness.
Well, I really appreciate you and all your work and your passion. And, you know, I think there's part of the reason why we do these webinars and feature experts like yourself is because there are a lot of providers out there who deliver ketamine as medicine, and they are by no means all equal. And many of them, in fact, are not doing best practices of care like what we're describing here. And not everybody, no one here expects anybody to do exactly all the things we're describing here, but there are a lot of practices that are not using any of this stuff, and that are you're not necessarily giving patients everything that they can get out of the ketamine experience. And there's a heck of a lot that can be gathered from these experiences, as you're hearing from the way that we're talking. And there's a lot more research that's ongoing right now that is looking into the difference between ketamine delivered alone and ketamine with therapy, and some of these other tools that will be start to be published over the next few years. But it's a very interesting field. And I think the concept of safety and how we do things, whatever it is we're doing things that enhance the safety of our clients and our patients in the office or at home, is what really unlocks the healing opportunity for people and helps people feel safe enough to really dive in and start to understand how to heal themselves. And if we can do things that amplify that part of the experience, then, like what Dr. James and his team are doing at Advanced Wellness and Pain, then we can cultivate experiences for our clients that really leave them beneficially impacted, not just in the short term, but also in the long term. And we can help people really get to those closer to remission or into remission from illness, which is really exciting. And it's something that we haven't had a lot of opportunity to do in mental health. So if you have if you have any questions, please reach out to myself, reach out to Dr. James and Advanced Wellness and Pain. And we look forward to hearing from you. Thank you so much for your time.
It makes you feel safe, and you have to feel safe, and then you have to be aware, ready, willing, and able to change. And we're trying to raise the gold standard by which ketamine is done by having conversations like this. You know, every clinic, there should be cameras in every room. So there's an objective eye. There should be these technologies to help you on this healing journey. There should be integration. There's so many different things, so many different boxes to check. So do your due diligence when you're looking for a ketamine clinic to have this medicine, because I think the real shame is if someone goes to do ketamine and it was done improperly and they say ketamine didn't work for me. It's not that it didn't work, maybe it was done wrong or just, not optimally. Right. And that would be a tragedy.
You do see that
thing. Yeah. It's our science. We're just trying to, further educate and raise awareness around the art. And Apollo is definitely an integral part of the art of ketamine.
Well, thank you so much, Dr. James. I really appreciate your time. And I look forward to chatting with you again soon.
100%. Until next time, my friend.
Take care.
Peace.
Bye.